Have you ever felt like no matter how much you give, it is never enough? And that is a daily reality for the countless nurses around the world. And the feeling is not just exhaustion, it's a deep human cry for balance, recognition, and support. Distinguished colleagues, respected judges, and all of the nursing professionals, my name is Hilda Nadira from Universitas Padjadjaran, and I am honored to take part of this king competition of Indonesia Nursing Student Competition. Allow me to begin with one simple rule, overwhelm. That's how many nurses in practice describe their daily experience. Nurses are the heartbeat of the healthcare, but today, instead of breathing strong and steady, many of them feel like they are gasping for breath. The workload is relentless, the number of patients is rising, and the complexity of care continues to challenge their limits. This burden is not a fleeting phase, it's a global crisis impacting their well-being, their professional identity, and ultimately the quality of care they provide. Let's look at the facts. In Southeast Asia and the Pacific, burnout rates among the nurses is the highest globally. In Lebanon, nurses are not only reporting about the emotional exhaustion, but also physical complications like back pain and fatigue. In Indonesia, our country, the challenges are no less daunting. In many hospitals, one nurse may be responsible for up to 20 patients per shift. Now, imagine. Amidst high loads, nurses are also expected to meet the documentation standard, updating patient records, collaborate with interprofessional teams, and also have to still maintain a human touch. The expectation is heroic, but is it human? And more importantly, is it sustainable? Now, we must ask, how can we turn this crisis into an opportunity? And one promising answer is technology, not to replace the nurse, but to empower them. Digital health technologies, from electronic medical records to AI-driven decision support system, have the power to streamline their work. For instance, the use of record medication administration reduces medication errors. Mobile apps allow community health nurses to access and input data in real time during health visit. Automated reminders ensure all the follow-up are not missed. And these are no far-fetched ideas, they are here and evolving. However, embracing technology is not without resistance. Many nurses may feel unfamiliar or even threatened. That's why we not only need a tool, but also a training and mindset shift. We must build a culture where digital literacy is seen as a part of professional competence. In addition, technology must be designed with the workflow of nurses in mind, not imposed top-down, but developed hand-in-hand with the users. What could happen if every nurse could save just 30 minutes of administrative burden through digital innovation? The 30 minutes more for patient listening, for mentoring junior staff, for taking a breath, and also for being a human. That's the essence of empowered nursing. So today, as a nursing student myself, I invite all of us, educators, clinicians, and policymakers to envision a future where technology is not a barrier but a bridge from being overwhelmed to being empowered, a future where technology and innovation is harnessed not to replace compassion, but to create more space for it. Let us move forward with no fear, but with hope and innovation. Because when technology meets compassion, extraordinary things can happen. I remember the future of healthcare is not built by technology-led nor by nurse-led, but by both working hand-in-hand together. Let's be the generation that makes that future real. Let's not just survive, let's thrive. Thank you so much.